Hello, and welcome to Counseling Ethics, Lecture 4. I'm Dr. Amber Hughes, and this lecture I'm going to go over counselor identity. Okay, so one way, or the really big way that we determine what our professional identity is by the philosophy underlying our services, not the specific service rendered. And the way we do this is often by comparing ourselves to other professions. Counseling is relatively new in the helping fields. It's certainly newer than social work. It stems from career counseling, actually, starting in the 1900s, and career and vocational counseling. But it also shares a lot in terms of theories and techniques with the psychology field. Okay, and so there's a lot of similarities in what we do, whether you're a social worker, a counselor, or a psychologist, but we all have our own little piece of the puzzle. And counseling is specific, is distinct in a couple different ways, which I'm going to talk about here. So the first is our services. So the basic services that counselors provide is counseling. So we really focus on the counseling services. Again, you're going to see social workers and psychologists do counseling. They might call it therapy. They might call it psychotherapy. It's all essentially the same. It's that talking to help people feel better. But we focus on counseling practice, whether it's couples, families, groups, or individuals. Our primary service is to provide counseling, and so your training is really focused on counseling. So we're very specific in your classes that you take to really help build your counseling practice. For other mental health professionals, counseling can be secondary. So it might be secondary to case management or advocacy. So social work is really tied to advocacy and kind of looking at issues from a more systemic perspective. Some professions like psychology may put assessment or diagnosis before counseling, and some psychology professions or fields, because psychology is broad, so it includes, clinical counseling psychology. Some put research first, and that's really it's really apparent in the training in the classes you take. So psychologists may take spend more of their time in their first couple of years taking classes on assessment and diagnosis and research, and maybe even teaching, and then get into counseling practice in their maybe second or third or fourth years, and they do their internship really at the end of their coursework. Whereas with counseling, we get you started on practice right away. We jump into counseling techniques in your second semester or your first year, and you're doing counseling then. And then in your second year, you're really doing your clinicals. And so we jump right into that practice. And again, social work is a little different, that they may focus more on the issue from a systemic perspective as opposed to an individual perspective. But again, at the same time, a lot of times you'll see people doing the same thing in organizations. So you may have the same job in your organization as a social worker. You may be providing the same service as a social worker. So the service isn't necessarily distinct. It's the philosophy underlying that service that makes this a distinct profession. So some of those philosophies that underlie our profession is first the wellness model as opposed to the medical model. So the wellness model is really looking at people from a holistic perspective and identifying the areas in which they need help. Okay, so the wellness model includes things such as spiritual factors, work. It includes community or leisure activities. It includes health and things like healthy eating and exercise and so on. And so we look at all those different factors, and there's several of them that form a wellness wheel. And that wheel helps us consider a person from a holistic perspective, and again, identifying some things that people need help on to make their lives more balanced. Okay, so it's really focused on a more positive approach to helping people get from point A to point B. And we see wellness occurring on a continuum from self-actualization, so really mentally healthy people, to dysfunction. And these are people with more severe issues like personality disorders, like schizophrenia or borderline. And I say as opposed to the medical model. So the medical model, which is employed, it's employed by counselors because we all work within the same system of diagnosis and insurance. But the medical model really is one of diagnosing a problem and then choosing treatments to help fix that problem. So the approach is one of you have a problem that we need to fix versus you're a person, a whole person, and you may be experiencing some issues in a certain area. How can we help get you from point A to point B? The other perspective we take as counselors is one of a developmental perspective. We consider most problems to be developmental in nature as opposed to pathological. So again, you're seeing that kind of distinction from the medical model of diagnosing. And most problems are considered normal and natural. So things like attachment issues in early childhood or identity development in adolescence and adulthood, normal stress and anxiety that you experience at certain times in your life. So think about, starting a new program and, a new master's program. That's super stressful, trying to balance work and family and school. That's a really, really stressful time of your life. So it's normal to feel certain levels of anxiety and stress and maybe even depression. And those are all normal feelings that are more developmental in nature versus diagnosing those issues as anxiety disorders. Okay. The third kind of tenet or philosophy underlying counseling is a focus on prevention and early intervention. And so we stress that counseling is for everyone. We say counseling, everyone could benefit from counseling, not just people in distress. And so we do a lot of teaching and educating, psychoeducation and counseling. And you'll see that in like parent education classes and career counseling and those kinds of focuses that focus on prevention and getting people kind of at the start of a problem. We do prefer to see clients who are experiencing difficulty prior to diagnosis, so prior to a time when it gets to a point where they're really distressed. Not that we don't see people on the other end of the spectrum who are really in times of distress, but our preference is to see people early on, and we really try and do that outreach and education to help people from getting to a certain point. And the final tenet underlying counseling is empowering clients. So our approach is really one to teach clients to be independent. And I mentioned this in a previous lecture. We don't want people to depend on us. We really want to help clients get to a point where they don't need us in the future. So a lot of what we do is teaching clients how to do things and teaching clients how to change. Okay, helping facilitate that change so that they can take that the skills that they've learned and apply it to different things, to different issues. So it's really about helping clients with coping and learning life skills and helping them understand themselves in a way that they can facilitate change themselves versus us doing it for them. And those are the main philosophies that underlie our profession and that differentiate us from other helping fields.